looks like that. You're only seeing it in the kids. It's an epidemic.
Thank you, Mr. President. I was hoping that you could clear up confusion for moms and dads across America, many of whom voted for you. There's a statement that was put out by the American College of Obstetricians and Gynecologists, and in their statement, they write, Acetaminophen remains a safe, trusted option for pain relief during pregnancy, and that's at odds with what you said and with what many of the experts say. How do you clear up this confusion?
That's the establishment. They're funded by lots of different groups. And you know what? Maybe they're right. I don't think they are, because I don't think the facts bear it out at all. They're fighting for something that, in my opinion, they shouldn't be fighting for. But here's the thing. There's no downside to doing, other than a mother will have to, as I say, tough it out a little bit. There's no downside to doing this. It's not like, oh, if you do this, you're going to die. There's no downside. There's no downside to going over a 4-year or a 5-year period or a 3-year period, or even if you space them out for 6 months, you space it out. There's no downside. And that's why I will say the gentleman behind me, they have very strong views, and they feel that we're right, but they'll have more research done over the next 2 months. I said, well, 2 months is a long time. A lot of people could be saved, and there's no downside to doing it. Everything I said, there's no downside to doing it. It can only be good. And I think you're going to see very good results. That's establishment stuff, and we've been reading that about a lot of things for years. And you know what's happened? We've gone from 1 in 20,000 to 1 in 10,000 to 1 in 32 to 1 in 10. Think of it. 1 in 10 or 12 or 1 in 31. Think of it. 1 in 31 people, young kids, get autism? What is it, Jeff?
My question is about leucovorin. You mentioned that as part of your plan. That is also a chemotherapy treatment. Have you been in touch with the drug companies to increase production about that? And I'm going to throw in my follow-up at the same time. Dr. Oz mentioned that this will be available with CHIP, children who are on CHIP. But the big beautiful bill reduced funding for CHIP and Medicaid by $1 trillion over the next 10 years. Are you concerned that that will impact your ability to get this drug out?
I'll explain it to you in a second, but please go ahead.
Thank you.
Thank you. Leucovorin is not a chemotherapy, but it is a vitamin given with chemotherapy sometimes. And the idea here is that the folic acid receptor in the brain is blocked by some antibody response. It might be 20, 40, 50% of kids with autism. And leucovorin will bypass that blocked receptor. And that's why so many doctors are probably seeing so much clinical improvement on kids with leucovorin.
So are you going to increase production?
Yeah, we've been in touch with the companies, and they are prepared to ramp up production. And we actually talked to them about a month ago.
And on your second part of your nasty question, the number is that the great big beautiful bill, which is the greatest, I think one of the best things ever passed in the history, with the tax cuts and regulation cuts and all of the things it does, no tax on tips, no tax on Social Security, no tax on overtime, all of it does. It also gives $200 million, as just explained by Dr. Oz, and I'd like you to explain that to exactly what you're saying.
The Big Beautiful Bill actually increases Medicaid spending projected over the next 10 years by $200 billion. There's also a $50 billion Rural Health Transformation Fund, which will allow a lot of these programs to get in the rural parts of the country that the President and Congress are handing to governors to start distributing. Those grants have already gone out. The money will be allocated by the end of this calendar year. And I want to point out that the ability of NIH to do research that feeds and hands the ball to the FDA, which then can change labeling to allow Medicaid programs in states to fund this program, will ensure that the things that President Trump and Secretary Kennedy desire are financially affordable for the families around America.
You mentioned CHIP, sir. That's why I asked that question. You mentioned that CHIP would fund this for children.
Well, most of the kids are on Medicaid, probably 43% on Medicaid, another 8-10% on CHIP. And all the programs in general are being evaluated. Most of what the One Big Beautiful Bill was seeking to do was to remove fraud, waste, and abuse. But the programs themselves should stay financially intact for the people for whom they were designed, and in this case, for children.
And the only thing we cut, so that's $200 billion positive. The only thing we cut was for fraud, waste, and abuse, of which there was a lot in this country, and nobody minds that. Yeah, please.
Mr. President, no reason to give newborn babies hepatitis B vaccines. But hepatitis B can be contracted not just through sexually transmitted diseases, it comes from needles to open wounds. So when you say you feel, is that appropriate to be telling?
I think it's
public?
absolutely appropriate. I think they should wait till they're 12 years old. Yes, please.
Mr. President, thank you all for being here. You've been talking about reducing autism by spacing out vaccines. Would you like other combined vaccines babies receive to be spaced out like MMRV?
What is this again?
You've been talking.
Speak up, please.
Sir. You've been talking about reducing autism by spacing out vaccines.
Right. Correct.
Would you like the other combined vaccines babies receive to be spaced out like MMRV?
I would say yes, but that just is, for me, it's a lot of common sense involved in this. It's a process, but we're looking, but it should at least be given separately. Now, it's possible that you can reduce them and give it, I'd give them in small doses, but it's possible maybe in that particular case, the MMR wouldn't work in small doses, but you can certainly give them as separate shots. It's been proven to be very safe when you give them in separate shots instead of mixing. So I don't think there's any reason to do that. Do you agree with it? I'm not a doctor, but I'm giving my opinion. I don't think there's any reason to do that. So it's been proven to be safe when you break them up. But MMR by itself, I've heard bad things about it for many years. Yes, please.
Is the spectrum too broad, in your opinion? For research purposes, you are dealing with a population of children who might have social boundary difficulties, and then you have children who are, going to grow up to be adults in diapers. I mean, what do you think?
We don't know how broad the spectrum is. We don't know exactly where it starts and where it ends, but we do know what we're going through. We're going through some very serious trouble, and we know autism. I mean, it could be bigger, it could be small, a little bit smaller, but the number is unacceptable. And the number, the way it's come down, because the spectrums remain the same, the number, the way it's come down is just unacceptable, meaning come down to that level of 1 in 10, 1 in 12, 1 in 31.
Mr. President, medical professionals.
Go ahead in the back.
Mr. President, this question is more directed towards Secretary Kennedy. It was talked about that we're just kind of finding out about the fact that babies are affected this way. Is there a concern that information is being suppressed right now within HHS, and could an investigation perhaps be launched seeing any more?
Well, I think information has been really not given out very freely over the years, absolutely. And I think that's by drug companies and maybe doctors, but I certainly think that over the years. I think this is a different group. We have a lot of information. And that information, I mean, it's the information that we have that we're making these statements. And I'm making them out front, and I'm making them loud, and I'm making them strongly not to take Tylenol, not to take it. Just don't take it unless it's absolutely necessary, and there's not too many cases where that will be the case. And again, what's the worst? The worst is nothing can happen. It's very positive. That's a positive thing. But I don't believe I don't actually believe that's possible. I think the results are going to be amazing. I want to see amazing results by the time I leave this beautiful building. And I will consider this, I believe, with the wars, I've stopped 7 different wars. I've saved millions of lives. I've done a lot of things. This will be as important as any single thing I've done, because I know ladies, beautiful ladies just like this that are going through the same thing, and it's not easy. And I admire you for being able to do it. But I admire him, too. I wish I had a face that looked like that. If I looked like him, I would have been president a long time ago.
Widely used in other countries too. As you make this announcement, do you expect your decision may affect
I
other
hope they
countries?
follow it, yeah. I hope they follow it. Yeah, other countries are, sell Tylenol. Some countries don't. I mean, I hear Cuba. Now, again, you'll have to check this out. But I hear Cuba doesn't have it because it's very expensive. And they don't have the money to have it, or they don't want to spend the money to have it. They don't have Tylenol. And I hear they have essentially no autism. So you'll have to check it out. Yeah, Brian.
Medical professionals have warned for decades.
I said, no, not you. You're CNN. You're fake news. Go ahead, Brian.
Thank you, Mr. President. I want to go back to the Amish community, if I can, just for a second. I recently saw a man from Minnesota, an Amish man from Minnesota, on a podcast, And the host asked him what the rates were for like ADHD and autism, and he had no idea about ADHD, didn't know that it existed, and certainly didn't know of any cases. What are they
It
doing?
doesn't exist with the Amish community, and they don't take all of this junk. It doesn't exist. That tells you, doesn't that tell you? That's like, that's like certain countries where it doesn't exist and they don't take it. Would you like to make a comment about that, Mark?
The Amish population, a very mixed group, so there's a subset that take vaccines, a subset that does not, and we know they have very low rates of chronic disease all across the board.
Please.
Thank you, Mr. President. Should the establishment media show at least some openness to, trying to figure out what the causes of autism are?
I wish they would, yeah.
And why are they so closed-minded?
Well, look, it's not only the media, in all fairness, it's some people. When you talk about vaccines, they go crazy. And, I'm a big supporter of vaccines. I got a certain vaccine approved in 9 months that would have taken from 5 to 12 years. I'm very proud of it. A lot of people think it was one of the greatest things I've done, and some people think, mostly Republicans, actually. I'll tell you, the Democrats think it was, they think Operation Warp Speed was one of the greatest things any president has done, any president. It's, we're very proud of what happened. We got hit with something that came from a place that shouldn't have happened, but it did happen. Those things take place, and you're very unpleasantly surprised. But no, I'm a big believer in vaccines. The polio vaccine, big believer in vaccines. I know Bobby and you guys have it out a little bit, but he's a believer in vaccines too. But I've seen how great vaccines can be, how incredible they can be. So I'm a believer. Yeah. Yeah, please.
Your comments made about MMR and hepatitis C, and you said those were your suggestions, but have you spoken with Secretary Kennedy about actually making those changes?
I have, yeah, I have. I've spoken to all the doctors about it, and doctors that are not here right now. I've spoken to many doctors about everything we're talking about. And, the Tylenol has started to be spoken of over the last period of time, but we've been doing the research. A lot of what they've been speaking about comes from right here, by research done by these people. And I just say it again, don't take Tylenol. Don't take it. And don't give it to your child after your child is born. And do all those other things, little things, just spread out your visits, et cetera, on the vaccine. And I want to thank everybody. This is a very important day. Thank you very much.